Hi, my name is Jennae McCully. I attend Notre Dame Cathedral Latin High School, and I will be presenting rates of immunizations for HPV and chickenpox vaccinations among individuals ages 13 to 28 years. How good are we? Introduction. This study is a descriptive epidemiologic evaluation which analyzes the rates of vaccinations among the patients of Cleveland Clinic CC and target areas for improvement. This serves as a quality improvement activity for Cleveland Clinic health systems. Background: HPV Gardasil vaccine. HPV, human papillomavirus, is a disease that can eventually cause cervical cancer, vaginal cancer, vulvar cancer, penile cancer, cancer of the oropharynx, and genital warts. Affects both males and females and can be transmitted by genital contact. Ways to protect against the human papillomavirus is avoid contact or immunization. The 4-strain HPV vaccine Gardasil prevents 70% of cervical cancer and 90% of laser-wave fungating external warts. There are 3 injections over 6 months, and it is recommended that girls and young women get vaccinated during the ages of 11 to 12 years routinely and 13 to 26 years if one has not already been vaccinated. It has been proven to protect against 75% of cervical cancer cases, 90% of genital warts cases in men and women, 70% of vaginal cancer cases, 12% of oropharyngeal cancer cases, and up to 50% of vulvar cancer cases. The side effects include pain, swelling, itching, bruising, headache, fever, nausea, dizziness, vomiting, fainting, and redness at the injection site. Varivax. Varicella zoster, or VZV, is better known as the chickenpox virus and is one of the 8 herpesviruses known to cause human infection. Varicella, chickenpox, and zoster is shingles. Chickenpox is spread by human contact through sneezing, coughing, or breathing. Varivax is given to children 12 months and older with 2 doses. By adolescence, children should receive the 2nd dose to ensure lasting immunity. Methodology. The data was de-identified, analyzed from EPIC by year of age for immunizations that the patients received. The data was managed in REDCap, Research Electronic Data Capture, using JUMP 9.0. The results. Of the age distribution and gender, the number of males that were collected were 1,986, and the number of females were 2,664, bringing the total to 4,650. And here are the following ages, the number of patients and percentage by the age. Among the HPV vaccinations, here is shown the cumulative rate in percentage of each age group with the 1st dose, the 2nd dose, and the 3rd dose. The most is seen with the 1st dose for 16-year-olds with little percentage in the 2nd and 3rd dose. And the chickenpox vaccination is shown for at least 1 Varivax or actually contracting the chickenpox disease and the 1st dose and the 2nd dose. And most people had at least 1 Varivax or the chickenpox among, again, the age of 16. Limitations. Only a relatively small sample size was able to be analyzed from the total number of patients in the Cleveland Clinic database. Patients who transferred care from elsewhere or received immunizations outside of Cleveland Clinic health systems, such as county health department or school-based health center, might be missing documentation of immunizations already received. Despite our best intent, numbers of patients from each physician were not represented equally, being because of the number of patients a physician would have due to each age group. Conclusions and recommendations. We concluded that the percent number of people receiving the HPV vaccine is lower than it should be. From other studies, barriers to care include perceived risks of the vaccination by both physicians and families. This knowledge deficit creates a window of opportunity for education. Families may be unaware that males may also receive HPV vaccination, and physicians may be unaware that HPV is covered by current insurers, including the Cleveland Clinic Health Plan. Room for improvement in chickenpox number 2 vaccination also exists. Recommendations. Further analysis using the entire available sample size is recommended. Families need to be educated on what the HPV vaccine actually is. Physicians must also bring to the attention of the patient and allow them the option of receiving the vaccine. It is vital that children who have not received both chickenpox shots must get fully vaccinated. The disease is not the benign childhood illness that many families remember. In its current form, it can be lethal. Acknowledgements. Special thanks goes out to the Cleveland Clinic Office of Civic Education Initiatives, Cleveland Clinic Pediatric Institute, Dr. Ellen Rome, Dr. Laura Gillespie, Dr. Kimberly Giuliano, Sarah Worley, Irfan Minhas, Sammy DeMarsh, and Harjot Singh. Thank you.